Barbara Lee is clearly one of the most prominent crusaders for the AIDS movement in the United States, certainly over the last decade.
The global HIV/AIDS pandemic is simply devastating Black America, Africa, and the Caribbean in disproportionate numbers to the rest of the world.
I think what distinguishes her is that she has advocated and developed legislation both for the epidemic in the United States and globally.
I remember meeting the Congresswoman in Mexico City at the AIDS conference almost 4 years ago at this point. And she was a rock star. She was the only member of Congress who was there. She's been to almost all the AIDS conferences. The fact that she was participating and listening and speaking and just active as I was, for example, at the conference, kind of really stood out for me.
Barbara Lee has always been one of the strongest supporters of the International AIDS Conference and what it can accomplish. In 2008, thanks to advocacy of Barbara Lee and many others, the travel ban prohibiting those persons living with HIV to enter the United States was lifted, permitting the conference to return to the United States after 22 years.
And many people don't know this, but she's been working on HIV/AIDS issues even before she came to Congress. She's working in the state legislature, following the lead of Representative Ron Dellums, who was working on HIV/AIDS issues as well. In her district in Oakland, she declared a state of emergency in Alameda County. She's been active for a very long time.
She advocated for the first ever national AIDS strategy for the U.S. She's fought for funding for domestic and global prevention, treatment, and research. She's backed HIV vaccine development.
Barbara Lee has championed attention to affected populations, including African Americans, starting in her own district, but also broadly in the United States.
She's been involved with every major piece of legislation dealing with global AIDS issues since she was elected.
PEPFAR is truly one of those remarkable global programs that has been launched against a devastating disease. In 2008, Barbara Lee was critical in reauthorizations of funds for this program, which showed excellent early success, which has led to the prevention of millions of HIV infections and saving the lives of millions of people living with HIV.
Under PEPFAR, she's working to get rid of a requirement that countries support abstinence programs in order to get funding, which would make a huge difference in educating sex workers about HIV and increasing testing and treatment in those communities, some of the hardest hit by the epidemic. She also co-authored the legislation that created the Global Fund, which at the time was the largest financial commitment of any nation in history to combat a single disease.
The future of the AIDS response is, I think, literally shifting in front of our eyes, and what it is today is going to look different in 2 years. So having her at the forefront with partners like Mr. Waxman and others is key.
She recognizes the potential of the new scientific interventions that we have to truly turn the tide on the HIV epidemic.
She really is the moral compass that drives the work and the passion that exists throughout our office, throughout all the staff members. And having her guide the AIDS response at this very pivotal time, I think is very important, not just for Congress, but I think for the larger HIV/AIDS community as well.